Hey guys, it's Miss Harrell. I hope you had a great little spring break. I know that it's tough. We didn't get to travel anywhere. I know that this is kind of an inconvenient time period to have spring break, but just hang in there, stay tough. I hope that you're safe. I hope that you are healthy, and I hope that everything is going well for you. So, today we're going to be learning about labor and birth. That will be the topic for this entire week. So, please make sure to follow along and pay attention during this presentation. So, the first thing you're going to need to do is go watch this video. There are two questions on your note packet about this video. So, please make sure that you watch this video and get that filled in your note packet. All right, so early signs of labor. Sometimes mom goes into labor a little bit early. This is called premature labor. This happens when baby has been developing in the womb for less than 38 weeks, so 37 weeks or less when baby's in there, but mom starts to show signs of labor. Warning signs are contractions every 10 minutes or less, a feeling of a constant dull backache, leaking of fluid or blood from the vaginal area, and sometimes doctors can give medication to stop this process. So that's going to vary from woman to woman, case by case basis, based upon how far into labor is she already. Is she pretty far along? If she is pretty far along, they probably cannot stop it. If she's still in the very beginning stages of stage 1 of labor, then they probably can do something to go ahead and stop it. But again, case by case basis. Sometimes women can experience false labor. There's 3 signs pretty typically that we see for false labor: contractions that are not regular or rhythmic, contractions that do not get stronger over time, and contractions that end with light exercising such as walking or stretching. And this can occur in hours or days before real labor occurs. Over here on the right, you'll see an infographic here that describes the difference between false labor or real labor. So the difference is with the timing of the contractions, how the contractions are affected by movement, the strength of them, and the pain attached to them. When inducing labor, doctors can do this by artificial means. Usually it's done with medication, also can be done by puncturing the amniotic sac. Now, that will only happen if a woman's water has not already broken. Would they need to puncture that amniotic sac? So, again, if that amniotic sac has not yet broken, that would be a reason why doctors may go ahead and puncture it themselves. The reasons why women may be induced, it can be for medical reasons, but also for emergency reasons. So if baby is slow developing or still inside of mom after 42 weeks of pregnancy, doctors may choose to induce her into labor. Also, Sometimes the amniotic sac breaks, but labor doesn't begin. So, what that means is contractions do not start right away for all women. So, the doctor may need to kickstart those contractions by giving mom what they call Pitocin, and that is given to mom through an IV, and mom goes ahead and gets that IV fluid through her body. The pitocin starts to kick in her hormones, causing her body to then start to contract, telling her body to contract those muscles around the uterus. The contractions will then push baby lower into that birth canal, eventually leading to mom being able to push and for baby to be born. This does not change the labor process at all, so mom can still have a natural birth. She can have an unmedicated birth if that's what she would like. So, again, this does not change her process. So, when talking about labor, we have three main stages. Stage one is when the contractions are opening up the cervix. Stage two is basically when the baby is born, and stage three is when we expel the placenta. All right, so to explain the first stage of labor more in depth, this begins when the contractions are coming at regular intervals. So, meaning that contractions are approximately 30 seconds long and can be up to 20 minutes apart. So, in the beginning, you may experience a 30-second contraction, then there's a 20-minute break, and then it happens again for 30 seconds. So, that's the beginning stages. Then, mom may start to go into active labor. This is when her contractions are 60 seconds long and they're only 2 to 5 minutes apart. Most hospitals will not admit a woman until they are in the active labor stage, so mom should not go to the hospital until she is in active labor. This time frame is when mom becomes very focused. She needs support from her partner. So she needs to utilize those coping techniques like walking and breathing exercises that will help her be able to feel more relaxed and more at ease during this process. This is also the stage where mom can get pain medication if she's interested. The most common pain medication that mom can get is an epidural. This is a shot into the spine. There are a couple different options, but this is the most common version of pain reliever for labor. As the cervix dilates, the baby moves lower into that pelvic region. Most babies will enter the world head first, but sometimes baby does not cooperate and they are not moving into the proper positioning. We call this breech presentation. So this means baby is foot first. This can be very, very dangerous to a baby's bones and to the muscles in baby's body. So doctor may have to go back and look and figure out, is a normal delivery possible? So what that means is if it is not, mom will need a C-section. So that's a big concern that doctors are looking at in the last couple weeks of visits to the doctor's office during mom's pregnancy, checking to make sure baby is moving into that head first position instead of in breech position. At the end of this stage, we call this the transition. This is when the cervix is fully dilated to about 10 centimeters or 4 inches wide. Strong contractions are occurring, lasting up to 90 seconds, and they're only 2 to 3 minutes apart. And this is very difficult for a woman. She needs a lot of encouragement and reassurance from her support partner at this time. The second stage of labor is when contractions are the most productive. Those contractions are pushing baby through the pelvic region out of the vagina or the birth canal. This is when it is safe for a woman to push. When she is pushing, she's using her muscles to help expel the baby. During labor, the hormone called relaxin allows mom's ligaments and her pelvic bones to stretch. So basically that means her pelvic bones are going to widen here, allowing for the passage of baby's body. It also will allow for the walls of the vagina to stretch so baby can pass safely through both the vagina and through the birth canal. Baby's body is designed for this journey. Their soft skull lets baby's head become longer and more narrow than usual. In rare cases, there are times where baby may have some complications with what their head looks like coming out of the birth canal, but with today's technology, most of the time we do not see that happening. If the opening of mom's body is too small to accommodate baby's passage, the doctor may perform what we call an episiotomy. These are not usually performed any longer. It is actually something of the past to have them done. Currently in medicine, they are recommending that mom does not have an episiotomy. So basically, an episiotomy cuts mom from the opening of her vagina to the opening of her anus, allowing for wider passage for baby's head to come through that birth canal. But if mom naturally tears, she's less likely to need as many stitches. Less stitches means less recovery time. Less recovery time means less time mom's in added pain while also trying to take care of a newborn. Also, as the baby's head is coming out, the doctor or midwife then will provide some gentle support to help baby out. Once the head is out, one shoulder comes, then the other shoulder, and the rest of the body follows very quickly. So the most pushing has to come to get those shoulders through. That is going to be the widest part of the body and the hardest part for mom to get through. Sometimes if baby gets stuck, the doctor may have to use forceps, also known as surgical tongs, to grab baby and guide its movement. If the surgical tongs don't work for some reason, there's also a vacuum extractor that can be applied to the top of baby's head to pull baby through that birth canal very quickly. This is one of the reasons that baby may come out with a deformed looking head, because that vacuum extractor is going to pull on the top of the head. Every baby has a soft spot on the top of their head. So if that's too much suction on the top of the head, it can cause the top of the head to misform because of the fact the skull's not fully fused together because of the soft spot in baby's head. So in the case of that, baby may have to wear a helmet to help the head go back to normal sizing and shaping. So this is a visual aid to explain cervical dilation. So basically, as mom's cervix is dilating, it is opening to be the size of these objects. When mom is 2 centimeters dilated, she is dilated to the size of a penny. When she's 4 centimeters dilated, she's dilated to the size of an Oreo. When she's 6 centimeters dilated, she is dilated to the size of a soda can. When she's 8 centimeters dilated, she's dilated to the size of a donut. And when she is 10 centimeters dilated, it is the size of a roll of cheap toilet paper. So, thinking about that, baby's head has to pass through that region. That is why the hormone relaxin is so important, and why we need mom to be fully dilated to 10 centimeters before a safe delivery can happen. Then we have the third stage of labor. This is the last stage. It is brief, but it is also still important. Mom may feel a desire to push during this time. She also may feel a few contractions. It is usually not painful just to push the placenta out. Once the placenta is out, the birth process is over. Mom can now finally bond with her new baby, and the doctor or midwife can stitch up any episiotomy or tearing that may have occurred during the birth process. There are a few things to make mom be able to cope with labor a little bit better. So we have our two most common coping methods are medication and childbirth classes. Medication is basically going to give you the ability to lessen the amount of pain that you're feeling. You can get anesthesia given to you. Some of that is injected into your veins or muscles. It can make both mom and baby very sleepy. Most of the time, we will choose an epidural. The epidural is a shot into the lower back, numbing the lower half of the body. When this happens, though, mom will not be able to get up and walk again until that epidural has worn off. So kind of think of if you've ever had a cavity drilled in your mouth and they gave you a shot of Novocaine. That Novocaine may feel kind of funky in your mouth when you try to eat or you try to drink right after a Novocaine shot. You may notice you can't hold that liquid in your mouth. You don't have control over that side because it is numb. The same thing if the lower half of your body is numb, you're not going to have control over it. So what would happen when you try to stand up? You would fall. So that's of a concern. We don't want mom to fall, especially while she's in labor. A lot of harm that can be done to both her and the baby. So again, once an epidural is given, mom is bedridden until that wears off in a few hours. Also, childbirth classes can teach some different breathing and relaxation techniques. One of the most common childbirth classes out there are Lamaze classes. This is only one approach to childbirth education, but it is the most common in the United States. If you've ever seen a movie where a woman is in birth and you hear them use the breathing mechanism that sounds like that is Lamaze classes. So the he, who breathing method is actually directly related back to Lamaze. Also, this infographic up here in your top right-hand corner shows you some childbirth classes, relaxation techniques that you may learn. So that top left one is mom using water pressure to relieve pain in her lower back. The one straight across, mom in the purple dress, she's getting some gentle massage from her support partner. Again, over then to the right, mom is in the yellow there. She is sitting on a yoga ball, also maybe being called a birthing ball, allowing mom to bounce up and down, relieve some pressure in her pelvic region. Mom in the red dress on the left side of the screen there, she's getting some hip squeezes from her husband that can be helpful to relieve some pain or some stress in her hips. In the center there, we see a birthing tub allowing for a water birth because a lot of times water or hot water can be soothing to pain, especially pain related to muscle cramping or contractions. Again, mom in the yellow dress in the bottom left corner, we see her using a birthing ball in a different fashion. And then on the bottom right corner there, we just see mom in the hospital preparing for the birth of baby. So not every mom is going to have a vaginal delivery. Some women are going to need to have a C-section, also known as a cesarean birth. There's several reasons why this is performed. The first one being if mom shows signs of complications during her pregnancy. So this would be a C-section scheduled ahead of time. The second one being if mom's previous delivery was already a C-section. A lot of doctors do not want to perform what we call a VBAC. That is VBAC, vaginal birth after C-section. And that's because when mom goes into labor, if her body starts to contract, her uterus starts to contract, that could actually cause the scar tissue on the uterus and on the abdomen from the previous C-section to tear back open to separate if that scar tissue is not yet strong enough. So a lot of doctors will avoid that by going ahead and performing another C-section after that first child was born. They will make sure every child after that is a C-section again. Also, mom may have to have a C-section if her labor is not progressing normally. So if she's been in labor for an extended amount of time, but she's not dilating, or if she's having contractions, but her water's not breaking, or if she's fully dilated, but not experiencing contractions, any of these things that sound out of the ordinary for labor may cause the doctors and nurses to decide that a C-section will be best for mom. Also, if baby or mom is in distress during labor, they may resort to a C-section because they can get baby out fast and they have more control over the scenario. If they realize that baby's turned in the wrong direction and they cannot get baby to turn back into head first positioning, if baby is breached, they may have to perform a C-section. And then also, we see C-sections being performed more often if there are multiple children being born. So if you have twins or more being born, it is more likely to have a C-section than a vaginal birth. There are two options again for pain medication for a C-section. A lot of pre-planned C-sections are just an epidural. So again, that's shot into the lower spine, which then numbs the lower half of the body, so mom will not feel any of the incisions. She'll just be awake for the procedure so that way she can hopefully bond with baby right away. But If it's in the case of an emergency, they may have to use general anesthesia, so meaning that they may have to put mom to sleep during this process, and in that case, mom would not get that initial bonding with baby after baby is born immediately. A lot of times, dad can be present with permission, so they often need dad to scrub in and get into medical type of scrubs to be able to be in the room with mom, but there's usually a designated spot for dad or another support person to be there. Ultimately, though, a C-section is still surgery. That means it has risks, but it also can relieve stress on baby and speed up the delivery. The doctor has more control over the birth process also. So again, that is why they may choose to have a C-section if a problem is going on with baby. Mom may or may not be able to hold baby immediately after, based upon, again, the type of pain medication they had to give her. And then they will take her to the recovery room for a few hours after her C-section, where she'll be encouraged to stand up or walk with assistance to speed up her recovery. It may take up to 6 weeks for her to fully recover from a C-section. Okay, so premature birth. Premature birth counts for about 5 to 6% of all babies. So this means that baby was born again before reaching 37 weeks of development. Most often these babies weigh less than 5 pounds 8 ounces. And of course, the earlier baby is born, the less developed their organs are and the lower their birth rate will be. Nobody knows for sure why premature birth happens, but we have a few reasons that are linked to premature birth. So if a woman has already had a premature baby, she is more likely to have a preemie baby again. If a woman has current medical problems, she is more likely to have a preemie. If a woman is a teenager during her pregnancy, she is more likely to have a preemie because, like we talked back in chapter 2, the teen's body is just not ready for pregnancy. The teen body is still trying to grow itself. It's still trying to nourish itself. It's still trying to continue development. So when the body has to halt that process and give all of its vitamins and nutrients to that baby growing inside of it, that can cause a deficiency for mom, which then can be linked to premature birth. Also, moms that are malnourished are more likely to have a premature baby also. To prevent premature birth, we should make sure that mom is eating well during her entire pregnancy and getting that proper prenatal care. Premature babies are going to need some special care. They need controlled body temperature. This is usually given to them by putting them in an incubator, which is going to flush warm air around baby's body at all times. They may need controlled breathing, so they may have a breathing tube down the throat. They also may need controlled feeding, so they also may have a feeding tube down the throat that is feeding them or directly into the stomach. Some babies that are premature may be able to breastfeed or feed from a bottle. That is only the case if baby is already showing the signs of the sucking reflex, which is something we'll learn about in the next couple of weeks. Some children that are born prematurely will have lifelong health-related problems, but most actually do not. Usually by the time a child is 12 months of age, you can't tell a difference between a preemie baby and a baby born at their proposed due date. So by the time a child is a toddler, we cannot tell the difference between the preemie baby and the born on time baby. All right, so this wraps up our notes for this week. So, hopefully you were able to follow along. You got your notes filled in. Don't forget to submit these in Canvas to get credit for today's assignment, and then head back over to Canvas to do the assignment that comes after these notes. Have a great day.